Hi everyone, my name is Christina Baker. I'm a registered nurse at St. Luke's Monroe campus. I am also a clinical education specialist there, so I teach nurses, and I can talk a little bit more about that.
Maybe let's do that. Let's try and do it. If you hit the over buttons, it should keep going.
Okay. So my journey into becoming a nurse is a little bit, I got a little off track. So I didn't really do things the most economically smart way. I changed my major a million times in school. I took out a whole bunch of student loans. I didn't know what I wanted to do. I ended up becoming a social worker, which I actually really liked. I really liked to help people. That was always kind of the core, was I want to help people. And being a social worker was great. It was very rewarding, but there wasn't a whole lot of job security. I would get jobs that were grant-funded contract, short-term contract work, and then the contract would be over and I'd have to find another job. Or grant money would run out and a program would end and I'd have to find another job. So once I started having kids and I needed medical insurance and needed stability, I realized I need to either switch my career or get my master's in social work so I can be a therapist. And I really didn't want to do that. And so I remembered back to when I was having my daughter in the hospital and how amazing the nurse was taking care of me, taking care of my daughter. It left such a powerful impact on me that I felt like, I think I could do that. I think I could still be helping people and, I could really make a difference in people's lives during their most vulnerable point of, their life. So I decided to go back to school for nursing. I had already had my bachelor's degree in social work. So all I needed was a couple of science classes and my nursing classes. So I went to Northampton and I became a nurse. I passed my boards and I started working at St. Luke's. The great thing about working for a hospital is that they will pay for you to continue your school. And so I got tuition reimbursement and I went to Moravian and I got my bachelor's in nursing. And now I'm going to Capella online for my master's and I should be done with that in the summer. And the great part about that is all of my student loans are back from when I got my social work degree. I have almost no debt because of nursing, because the hospital has helped me pay for school. I started out as a med-surg nurse. So I was taking care of patients that were admitted to the hospital. I did that for about 1.5 years, and then I moved to the emergency department, which I absolutely loved. I absolutely loved being able to make an immediate impact and a difference on people's lives. Like the turnaround for what you can see you can do for somebody is almost instantaneous in the ER, because somebody comes in and they're bleeding and you can help them stop the bleed. They're coming in and they're having chest pain and you can help make them feel better. So it was kind of like an instant gratification and also very exciting. Then I started realizing that I really like to teach nurses. So I would be the preceptor for any new nurses that came on board and I would be teaching them and I really enjoyed that. So I started looking into a little bit more about doing education. And so that's what I do now. I am a nurse educator and I teach new nurses. I teach orientation. I teach internships. Whenever we have a new process or a new piece of equipment that everybody needs to know about, I go around and I teach the staff. So I really, really enjoy that. I'm not doing patient care necessarily anymore, but one of the great things about nursing is I can always go back and I can always change it. So that's kind of my journey. For those of you who are interested in going into nursing, a lot of times people are interested because either you have family members who are nurses, and it's kind of like a generational thing, like you come from a long line of nurses, or you have some sort of personal story. Maybe it's an experience you had or a family member's experience that you had that causes you to feel like, ooh, that's really cool and I want to do that. So if you don't mind sharing, what are some of the reasons why you're interested or maybe thinking about nursing?
Isabella, you want to go first?
I've always been interested in medicine. My grandma's an office manager at a medical office. So I was always going there as a kid, so I always found it interesting. So yeah.
That's cool. Yeah.
I again I've always been interested in like being some sort of like doctor or nurse or whatever. But the big thing that I like that made me want to be a nurse is that like back in when I was in ninth grade, I had like a heart arrhythmia, but my like doctors didn't know I had one until one day I was at school and then my heart rate got to 210 and then I walked to a nurse and it was at 45 and she was like, you have to go to the hospital right now. So it's possible, and then they're like, oh yeah, now we know what it is. And I feel like for me that was tough because I'm an athletic kid, and so I couldn't do gym, I couldn't do my sports, and like my parents were always like, yeah, it needs to take it easy. And like, so I feel like it was just tough because they didn't know what was wrong until they saw like my heart rate like on the monitor and everything. And so like now like I kind of want to like help the kids so they don't have to like, suffer, and like as long as I want to try and like take home their like cases and like be there for them because I kind of know what it feels like to have like a problem that takes a while to like solve.
Yeah, and it's when it comes to your health, it's one of those things like you take it for granted unless there's something wrong, and when something's wrong, then you really realize just how important everything is, and to be able to be that person for someone else, that's pretty special, and it's kind of an honor to be able to impact someone's life that much. So yeah, everybody kind of has their own reason. The reason why that's really important is because to be a nurse, a lot of times what they say is it's like who you are inside. It's not necessarily a job that you clock in and you clock out of. You know, you can clock in and clock out of a job, leave it at home, and that's your job title. This is like a career, and it's something that becomes a part of your life. And that core feeling in your heart of like, I want to help people, that's something that you got to have, because there's a lot of days where being a nurse is really hard. And not just a nurse, anything in healthcare. You can have those days where it's just such a challenge and it's super hard, and you have to go back to that feeling in your heart of I'm in this because I want to help people, and it's what's in my heart. So a couple of reasons why people choose to be in healthcare and be a nurse. Obviously, you make a real difference in people's lives. Like I said before, there's job security and stability. There's always going to be a need for healthcare workers. That's never going to go away. So it's not a career that will collapse or fall apart, or, you know, we can't replace nurses with robots, you know? So being in healthcare is job security. Many times when they survey nurses, most recently a survey that went out said that 83% of nurses have job satisfaction. And that's a big number, because not a lot of people are very happy in their jobs, you know? A lot of times people, they just do their job because it pays the bills, but they're not super satisfied in what they do. So that's an important thing to know. It can be very exciting. If you kind of are an adrenaline junkie, there's a lot of positions in healthcare that kind of satisfy that, like being a flight nurse and things like that. That's kind of cool. It's a very respected occupation. So it's one of those occupations that people have a high regard for. People look at nurses and they think like those are heroes. You know, I respect nurses. You can always change your path, and I'll talk about a little bit more about that. And there's always opportunities to grow. So you never really get too stuck or bored, and if you do, you can always change. So this is a quote that's probably a little hard to read, but it says, as a nurse, we have the opportunity to heal the mind, the soul, the heart, and the body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. And that's the truth. Like, I don't know who that nurse was who helped deliver my baby. I don't know her name. But I will never forget the way that she made me feel, taken care of and supported, and, you know, that's what we can do for people. I have a little video clip. I don't know if it's gonna play or if we have sound.
Yes, it should.
Okay,
Let's see.
so this is the story of one of our ER nurses, Michelle. Oh, I gotta change like the view or something.
Oh, yeah. Okay. Let's swing it over.
There we go.
And I've been at St. Luke's Monroe campus about 3 years. My parent enrolled as a registered
I'm
nurse.
gonna shut the lights
I work in the emergency department, which I love. Down here, basically my role is I'm firsthand, I take care of the patient. I'm the first one who sees the patient, so when the patient comes in, they see me, I do vitals, vital on my tech. I do the vitals, I do EKGs and they come in for chest pain. I do labs, IVs. I'm pretty much the second person next to my doctor, the provider, whoever takes care of them. I started off as a volunteer at first. This was like right after high school. And from there, I fell in love and I decided, hey, let's be a transporter. So I ended up being a transporter. And while I did transporting in the hospital, I went to school as a medical assistant. While I was in school as a medical assistant, I just fell more and more in love with my medical career. And once I finished, I worked in OBGYN, and I pushed myself and had providers push me to go back to school for nursing. I was in the emergency room department, and it had to be like a night shift. And I guess the patient had a cardiac arrest in the emergency room, in the waiting room, and the patient collapsed. And all I seen is coming out to go get another patient to bring him to like X-ray. I seen a stretcher go by, and the nurse was on top of him doing CPR. And right then and there, I'm like, oh my gosh, she's a superhero. I want to be one. I want to be a superhero. And right then and there, I just fell in love, and I knew the skills I need to perform my job as a registered nurse is basically teamwork. There's no I in team, so you need your coworkers to work with you. Communication, you need to communicate to radiology, to your techs, to your providers. You need all that because, again, teamwork. Have a tough exterior. Just know that they're in pain. You don't know what they're going through, and basically be compassionate and understand, because you can have a difficult patient, and after you work with them, they'll be so grateful for you and they will apologize. I can't tell you how many times people have apologized to me, and I completely understand, like, you're in pain, I get it, it's fine. I'm here, I'm doing my job, I'm here to help you. It's never a dull moment in the emergency room. You just never know what's coming in. And that's what I fell in love with, because it's never the same thing. You just never know what's rolling in through the doors. And you meet so many incredible people, and then you will see them again sometimes, sadly, but they'll remember you and they'll appreciate you.
Okay.
Let's close it out. Yeah. There you go. Oh, perfect.
That did work.
Yeah, right.
So some of the responsibilities that a nurse has is that, we have to work with a wide range of people. So you have to be a really good people person. You got to be able to manage different personalities, different people are raised in different ways, and you just have to be really good at navigating all of that. You have to be good at doing assessments, like physically examining someone. So you have to be really good at and being okay with being close to someone, physically close to someone, because you're touching them and you're listening to them and you're looking at them, and you're just, you really have to be good with close contact with people. We start IVs, we do vital signs, we do wound care, give medications. We're always observing for changes. So whenever we do something to a patient, we have to monitor and watch and see, did that help? Are they getting worse? Are they getting better? So you're doing a lot of monitoring. You delegate to your team members. You communicate very closely. So if communication is a struggle, because I find that a lot of your generation, you're used to communicating through your phone a lot, and texting each other and on social media, and that's how you're communicating a lot. But at work, you have to communicate face to face. You got to talk to doctors. You have to talk to patients and their families. Yeah.
Speaking of doctors, what? Do you think people do you think people think too much, they think doctors are superior to nurses and all of it? Do you ever find a stereotype where someone will ask for a doctor instead of when you're fully capable of doing the job done?
So that happens a lot. A lot of people, especially brand new nurses or brand new staff coming right out of school, feel very intimidated to approach doctors. My experience though, and I've only ever worked at St. Luke's, so I don't know what it's like in another health network, but at St. Luke's, the doctors are very, very approachable. We have a very good culture of teamwork. So usually if you approach a doctor and if maybe you're unsure about something or if you have a question, they are more than willing to help and they're more than willing to answer your question. It's one of those things you just have to remember, even though they have gone to school more than you, they still put their pants on one leg at a time. They're still human beings, and we are all part of a team. They cannot do their job without the nurses, and the nurses can't do their job without the doctors. So we all work together very closely. But yeah, that is a struggle. A lot of people do have that, like a little bit of intimidation, but a little bit more confidence in what you know comes with time. So one of the things as a nurse is you're taught how to be an advocate for your patient. And what that means is doctors can make mistakes. And so if you notice something that seems a little off, maybe the doctor ordered a medication that doesn't quite make sense, you have to have the confidence to say, hey, I noticed you ordered this blood pressure medication for them, but their blood pressure is low. I don't feel comfortable giving that. Did you mean to do that? And it's kind of like a lot of nurses feel a little nervous about questioning a doctor, but they can make mistakes too. So we're taught to question doctors, ask them why they do things, and most of the doctors are very willing to help and it's a team environment. Did that answer your question? We perform diagnostic tests. We operate a lot of medical equipment. We make treatment plans, and we do a lot of education. We educate our patients and our families. So if those are some of the things that seem interesting to you, that's kind of like a typical responsibilities of a nurse. So there's a couple of things you need in order to be a nurse. So do you have what it takes to be a nurse? So there's a couple qualities. Empathy. So empathy is, feeling compassion and feeling like you can understand what they're going through. And maybe you don't really understand because you've never had an appendix that was exploding. Like maybe you don't exactly understand, but you can empathize to the fact that this patient is in a lot of pain, and you kind of know how to talk to them and how to comfort them, and you know what you need to do. Maybe the family is freaking out because their child is going to go for surgery to have their appendix removed, and they're scared and they're worried, and this is, a nerve-wracking time. So you can empathize with the family who maybe is a little bit impatient, So having empathy, teamwork, we've said that a couple times. Flexibility. So things are always changing in nursing. It's not one of those jobs where you know exactly what you're going to do every day. Like you come to work and you have kind of no idea what could happen. You got to be able to move on your feet. You got to be able to think quickly. You have to be able to adjust. You can never really predict what your day is going to look like, which for some people, that's not what they're interested in, but some people really like that. Critical thinking. Critical thinking is an important skill, and that's something that is developed over time. Critical thinking is when you can figure out the why behind what you're doing. So if a doctor says, hey, I want you to get an EKG on that patient, you're not just doing the task. You understand why you need to get an EKG. It's because that patient has chest pain, and an EKG will tell you if they're having a heart attack. That kind of stuff. You're able to understand the why of your action. That's really important, critical thinking. You have to be hardworking, obviously. This is not a job that if you want to just hang out all day, it's not for you. This is, it can be physically demanding at times. You need to work well under pressure. You not have a weak stomach, so you're going to come in contact with a lot of things that are gross. Some weird smells. If you're queasy or on vomit or poop or blood, it's not for you. So you have to be not have a weak stomach. Be thick-skinned. That means you are going to be around people who are literally having the worst day of their life. They are terrified. Maybe they just got the worst news of their life. They got a diagnosis of terminal cancer. Maybe they're in excruciatingly horrible pain. Maybe they are, worried and they've been waiting in the waiting room forever. So they're angry. So you're going to come in contact with people who aren't always the nicest, because nobody's in the hospital because they're having a great time, or that they're having a great day. So you have to be okay with the fact that sometimes patients and families are not going to be the most cordial or patient or, understanding. And so you just have to understand that it's not about you. It's not something you take personally. It's just that they are having really, really a bad time. You have to be a good communicator and a good multitasker. So you're constantly juggling things. Sometimes you have to be able to manage your time and prioritize and all that kind of stuff. So registered nurses can work in a variety of different places. Obviously, hospitals is one of the biggest places nurses work, but outpatient clinics, nursing homes, medical office buildings, school nurses, you can do home health. There's a lot of things, many, many more, not just on that list. So what do you do to become a nurse? So obviously you apply to a nursing school. There is a couple of different ways that you can go to nursing school. You can either get a diploma, so that's not actually a college degree, but it's a nursing diploma, and you can get a diploma and still take the boards. So that's like St. Luke's School of Nursing is a diploma school. So you can go to St. Luke's School of Nursing, get a diploma. The benefits of that is it's fast track, so you can usually finish that in like a year and a half. You can get an associate's degree at like Northampton or any other community college, or you can go to university and get a 4-year bachelor's degree. It doesn't matter which one you choose. Any of those will allow you to sit for your boards. So it all depends on, money, where you want to go, what you want to do. I think if you want to save money, I think the associate's degree is probably the cheapest route. Then you sit for your boards. You have to pass your state board exam. It's not easy, but they do have licensing practice courses you can take that will teach you strategies on passing the test, how to answer the questions appropriately. If you don't pass, I think you wait like 6 months and you can take it again. So that's just, you gotta be licensed by the state. And then you apply for a job. A lot of jobs are now hiring right out of school before you even get your boards. They'll hire you with a conditional employment of you have to pass your boards, but you can already get your foot in the door. When you go to interview for jobs, be professional. There have been a couple of interviews that I've been on where the interviewee shows up in some sort of like nursing school scrubs. And although scrubs is an appropriate uniform for work, you still want to dress professionally for an interview. Sometimes there'll be panel interviews, so that's a little intimidating. You're interviewing in front of a panel of people who are all asking you questions. So some of those kinds of things might be important to like practice with your friends or your family members so you can get your nerves out. A couple tips. Nursing programs are very, very competitive. So when you apply to nursing school, you might be waitlisted first. They might say, we'll accept you into the college, but not into the nursing program yet, until you take a couple science classes and we see that you get good grades on your science classes. So some schools do that. That's what happened to me. All the nursing classes were full when I applied, so I got waitlisted. I had to take chemistry, statistics, anatomy and physiology, and microbiology first. And when I got good grades on those, then I got accepted into the nursing program. It's important to know the prerequisites that your schools are looking for. Like, are they looking for any specific like high school sciences? Most of them are okay with, most of them don't have necessarily anything specific, but the nursing programs themselves oftentimes require sciences in college. Another thing you can do is you can work as a tech or a PCA while you're in nursing school. So those are nursing assistants. That will help you, you'll get hands-on training, you get hands-on experience dealing with patients. You're hired by the hospital, so you're already got your foot in the door. The hospital will help pay for nursing school, and you can earn money while you're in school. So that's like what a lot of people do is that they work right out of high school, they get a job as a tech. A tech is specifically in the ED, or a PCA is working on all the other floors.
What does PCA stand for?
Patient care assistant. So as long as you're a full-time or part-time employee with St. Luke's, they will pay tuition reimbursement for you to go to school. And a lot of hospitals will hire from within, so it's kind of like you get a job as a tech or a PCA while you're in school, and you do a great job and you show that you're reliable, it's like a shoo-in, you automatically will get hired as a nurse. I know St. Luke's, and I don't know if anybody's familiar with this, I know St. Luke's and Northampton have given presentations here before, but they are partnering up and offering a scholarship to anybody who attends Northampton. Will sign a contract, you'll be automatically, it's a pretty great deal. You'll be automatically hired with St. Luke's. I think you have to sign a 2-year commitment, but they will 100% pay for all of your school. So it's a full ride to Northampton to get your nursing degree. And with the commitment that you'll work at St. Luke's for 2 years when you're done.
Which is like nothing.
Yeah,
know,
2 years goes by so fast, and it's, in 2 years you get great experience. You can kind of figure out where you want to go from there, and you have school completely free. It's pretty amazing. I wish I had that when I was. Another couple tips is nursing is a professional job, and what I mean by that is you have to be really, really careful with what you're posting on social media. Our human resources department has like secret shoppers, and they go out and they scout and they look and they see all the candidates that are applying. They will vet you and they will look at your social media. They'll look at any history that's online that they can access, because they're looking, because we want people who are going to represent St. Luke's in a positive professional way. If there's any, disparaging videos, pictures out there, they might not want to choose you, and they do look. So, and then once you are an employee with St. Luke's, you have to be really careful with what you post. I know that there was a couple of people that were posting very politically charged posts, and they do not work at St. Luke's anymore. So you have to be really, really careful. You're a representative of the hospital, and they take that very seriously. You have to be careful with tattoos. You can't have any tattoos showing. Most hospitals have a dress code policy where you have to have tattoos covered. I have a tattoo, so no matter how hot I am, I have to wear a long sleeve shirt at work. That was a decision I made when I was younger, before I got this job. And now, that's just saying, if you're thinking about getting a tattoo, keep that in mind, of where you put that tattoo. Same thing with piercings. You have to have them covered, or taken out. If you have like nose rings, lip rings, eyebrows, any of that stuff, you can't have. Any flashing nails. So a lot of people love acrylics and fake nails. This is a source of infection. So you're not allowed to have that. So if having nice nails is really important to you, it's part of the dress code policy that you don't have any acrylic nail polish or fake nails. You can't have any crazy hair colors, which is a bummer for me, because if I could do my hair in any possible way, it would definitely be in all crazy colors. But you have to have natural hair color. Dress professionally on interviews, I said that, and have a resume ready. So even if you've never worked before, it's important to have some kind of resume that has, maybe some activities you've done in high school or volunteer work, things like that. Some opportunities that you can do as a nurse, being a staff nurse. So that's what I am. That's what a staff nurse is at the bedside in the hospital. You could be a pre-hospital nurse. This is somebody who is on the ambulance trucks, a nurse that does the critical transports. You could be a flight nurse. That's somebody who, you go on a helicopter. So those are the really, really sick patients. You have to have a special certification to do that. A nurse practitioner. So that's someone who works as kind of like a doctor. It's kind of the same as a physician's assistant. They can prescribe. So if you get your master's in nursing and then you sit for your boards, you can be a nurse practitioner. You can be a trauma coordinator. So that's someone who just deals with trauma and how we take care of our trauma patients, making sure our staff is compliant with everything we need to do. You can be a nurse educator like me. Case manager. Case manager is kind of like a nurse social worker. So they help in making sure patients who go home, maybe they go home with, if somebody had a stroke, and they come in the hospital, we get them stabilized. Now they're ready to go home, but maybe they need a little help with a walker. They might not have a ramp in their house, so a case manager will make sure that they have what they need when they go home. A SANE nurse is a sexual assault nurse examiner, so if you're interested in forensics, there's a whole forensics nursing deal. A lot of it's revolving around sexual assault. Nurse navigators, they help cancer patients navigate their whole entire cancer treatment with all the chemo appointments, radiation, all of it's a lot for patients to keep track of, so nurse navigators do that. Hospital supervisor makes sure the staffing in the hospital is what a good safe patient to staff ratio. I'm sorry, did you have a question?
I just wanted to see the list first.
Oh, okay, sure. Clinical coordinators, they're kind of like a charge nurse, so it's just like they help coordinate how patients' assignments are throughout the shift. Nurse managers is kind of like the boss of all the nurses on the department. Administration, so like that's business, that's like your VPs. Those are all nurses who have their masters in nurse business. Safety and quality nurse, they make sure that we do everything so that making sure patients aren't falling in the hospital, that we're preventing infections in the hospital. Infection control nurse, they have been very busy with COVID, dealing with like making sure we have the right PPE and all that kind of stuff. Nurse informatics analysts are nurses that deal completely with IT, computers, documentation, making sure that the flow in our computers and our documentation is a friendly workflow for us. And then research. Research is really cool if you like being in a lab. There's nurses that conduct research and trials and help physicians and pharmaceutical companies come up with new treatments and medicine. Yeah.
Travel nurses are a thing too, right?
Travel nurse is really popular right now. Many organizations, travel agencies, won't hire you as a travel nurse until you have a little experience under your belt. So once you have some experience under your belt, you can get hired by an agency, and then they will give you a contract, whatever length of time that is, and send you to another hospital to fill in, for that contract period. There's a lot of money to be made in travel nursing, but you have to be really proficient in your skills. You have to be really confident. You have to have some experience under your belt because it's very hard to go into a new environment without any kind of orientation. You don't get really any training because you're expected to show up at that new hospital having already knowing what you're doing. So a lot of people think that you graduate nursing school and you can be a travel nurse. That's not the case. You do have to have some experience first.
Now, to be some of those things, like I know that you said, like for example, like the flight nurse is like a separate certification and stuff like that. Like, for some of the other ones, like I know, like like for example, like safety and quality, like how would you get into that role? Is there something additional that you have to do if that was the path you wanted to take?
Not necessarily. I mean, pretty much all of these, you have to have a little bit of experience. Like you kind of all starts off as a staff nurse.
Okay.
And that's really, being a staff nurse is really great because you really get a feel of what you like and what you don't like, what you want and what you don't want to do. And then from there, once you have that experience, you don't really need any extra education.
Okay.
Some jobs will require you, like if you're hired as the quality nurse, you're going to sign a contract saying you're going to get your bachelor's within 2 years or something like that, but you don't necessarily need to have it right off the bat.
Can you do like multiple of like the age thing? Like say like I want to be like the same nurse but also like a nurse navigator. Like is that possible to be like two different like job titles?
Yeah, so the SANE nurse is kind of a unique one. Again, I only know how St. Luke's does it, but that is a special certification that you get to become a SANE nurse. You get special training and then you're certified. And that you pick up your hours, you're on call whenever you can on your schedule. So like you could be a nurse navigator as your Monday through Friday day job, but then maybe like one weekend a month, you can be on call for SANE. And on call just means that if there is a SANE case, a sexual assault case that comes into any of the EDs in the whole network, they're going to call you and say, hey, we have an assault case, can you come? And then you would drive to that campus where the patient is and do your exam. You would be called in to testify in court if you need to, if your evidence gets questioned by anything, that kind of stuff. So SANE is a unique one because I don't think that we have any full-time SANE nurses. That's like an on-call position. But the great thing about this is that, like, I didn't start out thinking I was going to be a nurse educator. To me, I thought standing in front of a group of people and speaking is the last thing that I want to do. Like, this would have terrified me when I first started. And I just thought, like, I never wanted to be a teacher. Like, that wasn't my thing. And it didn't come until after I started teaching new nurses and I really, really loved it that I decided to give it a try. So, and one day I might say, I don't want to do that anymore. I want to do, infection control or something, or I want to work in research, and that can always change, and I can always go back. That's the great thing, yeah.
How could somebody go up to becoming a hospital supervisor?
So hospital supervisors, you need to be a staff nurse first, get some experience. A lot of times, like, if you show leadership qualities, you're reliable, you're dependable, you have good attitude, you're a role model, you might be asked to become a charge nurse. And a charge nurse, you basically are the support person for all the other nurses on the department. So if somebody needs help with something, you answer the phone, you help make schedules, stuff like that. Once you show that you're very good at that, then you can apply to be a hospital supervisor. Again, there's no additional degree you need to hold. The hospital might say, though, like, if you don't have your bachelor's, like, let's say you went to Northampton and got your associates, they might say, okay, we'll hire you as a hospital supervisor, but in 2 years you have to have your bachelor's or something like that. So as a nurse educator, they gave me 3 years to get my master's. Yeah.
So as a staff nurse, like, do you go through all the different floors, or do you specialize in a specific field, like cardiology or ER or whatever it is?
So we do have, there's med-surg nursing. Med-surg nursing in and of itself has different areas. So you could be on a neuro floor where you're taking care of people who have had brain damage. You could be on a cardiac floor, a stroke floor. So those kind of specialties, but you're still a med-surg nurse doing pretty much the same sort of tasks and responsibilities. Then we have specialty areas. We have the ED, we have labor and delivery, we have the OR, we have critical care, which is ICU, we have pediatrics, we have behavioral health. I think that's roughly it. You can be hired to work in any of those specialties right out of school as well. The only advice I have, though, is that it's very hard to jump right into a specialty without any nursing experience at all. Even just a year on med-surg, you will get really good at reading orders, talking to doctors, taking care of patients, doing your assessments, time management, prioritization, all of that stuff. Because we do hire people straight out of nursing school to start in the ED, for example, in the emergency department. And I'm one of the educators in the emergency department, and I see just how much they struggle. Because not only do they not have the experience taking care of patients, but now you add on the fast pace, the critical patients. Like in the ED, we see everybody. We see peds, we see behavioral health, we see critical patients, we see all the specialties come into the ER. And so you have to be really, really proficient in everything. And I see how much new nurses struggle with that. But we do take new nurses straight out of school into the specialties. We also offer internship programs for the specialties. So we have an OR internship, an ED internship, and a critical care internship, and a labor and delivery internship. Those are kind of like intense orientations where you, it's like around 6 months. And while you're learning and you're in orientation, once a week you meet together in your cohort and you go through things like in classroom style learning. So you learn equipment, you run through drills like mock codes. Like when somebody's in cardiac arrest, you run through it together in like a simulated environment. So we do offer internships for the specialties just to give new nurses a little bit of support because it is a lot to learn all in the first year.
Do you think it would also be harder than if they started in a specialty than to be familiar then with all that kind of stuff after getting to that point and then wanting to switch without having some of those basic knowledge stuff, or you think it's kind of equal regardless?
So no matter where you decide you want to switch to, you're going to have an orientation. So you're gonna be taught how to do the things you need to know in that specialty. But in my personal opinion, I think that if you have that baseline patient care experience where you have a comfort level with touching patients, listening to their lungs, knowing when something's wrong and when to escalate it to the doctor, knowing when your patient is declining and what are you gonna do about it, knowing when they're getting better and maybe it's time to go home. Like knowing all of that, that's a lot to learn. And I feel like if you've never had any patient care experience before, if you've never worked in a hospital, you've never taken care of a patient, I feel like that first year as a med-surg nurse is really vital. Now, maybe you worked as a PCA or a tech while you were in nursing school. That gives you a nice little baseline too, because you learn a lot from that. Even if you're not doing nursing jobs, you see what all the nurses are doing. So that's a really cool thing you can do. You can also be a volunteer. If you really aren't sure and you don't want to make a commitment, you can volunteer in the hospital. You can be a transporter. Our volunteers help with behavioral health patients. They help stock carts. But just being in the hospital environment and seeing, like, is this for me? That's another option too. And all that information is on the St. Luke's website. I also have my work email if anybody has any questions about anything, and you can contact me anytime. I'm happy to answer questions if you wanted more information about volunteering or getting a job or about that Northampton scholarship. I can always, answer your questions or help you in any way.
That's great resources. Yeah. Anyone have any other questions that you want her to address now?
I would just say the hours are with working and family life. Do you think it's pretty doable, or do you think it's you find it tough at times? Or
Yeah, that's a great question. And one of the things that I find to be a great benefit about being in healthcare is that the hours are very flexible. So there are some negatives and some positives. So the negatives would be you have to work every other holiday, and there really isn't any way of getting around that. The expectation is that you work every other holiday. You can kind of work out switches with other people, but you kind of have to go in knowing I'm going to have to work some holidays. You have to work some weekends. So if that's completely I definitely don't want to do that, then there's no way around that. You got to work weekends and holidays. So that's a negative. If you have a family, that's tough to have to miss out on holidays, right? But the benefits of it are it's extremely flexible. You can work 5 days a week, 8 hours each day. You can work 3 12s. You can work 4 10s. So 4 days a week, you work 10 hours and then you have 3 days off. Most new nurses start off on night shift. And I mean, that's, unless you get lucky and somehow, you get hired for a day shift, but day shift is usually what everybody wants. So senior nurses will take those. So night shift is a weird thing to get used to. It's tough. The great thing about working night shift though is that your team on night shift is solid. You guys are a family and you work together and you have those 3 a.m. Coffee breaks together and so the night shift team is awesome. Day shift is extremely busy and chaotic and crazy and you don't really have that same camaraderie. So night shift is really cool for that reason. But it's flexible. So if it works out for your family with your kids for you to work nights because then you can sleep when they're in school or something, that option is there. If, working 3 12s works better because then you only need daycare 3 days a week, you can do that. We also have a weekend program. It's kind of hard to get into a weekend program. Weekend program's great. You commit to working every single weekend for double pay than what the nurses during the week get. So you can work 2 days a week and you make just as much as somebody who works 40 hours a week. So that's what a lot of people with families do. So if, your spouse works Monday through Friday, you have the kids Monday through Friday, and then they have the kids on the weekend and you work the weekend and you're done in 2 days. The downside of that is you're committed to every single weekend, so you miss weddings and families and family events and stuff, but that's an option a lot of people take. Yeah.
If you work the night shift, what was it like balancing out with families and taking care of the kids?
So when I was a night shift nurse, my kids were already in school, so they weren't little babies. So I would come home from work, get them on the bus, and then I would sleep until 3 o'clock. And then I'd get them off the bus, get them dinner. By then my husband was coming home from work, and then I'd go to work. And that worked really well for our family for many years. I did night shift for about 5-6 years. And then my kids were old enough to walk to the bus by themselves, and they didn't need me to do that. And so I was able to move to day shift, but yeah.
And kind of like she said, it's about balance. So like, you know, you kind of have to pick and choose. Like maybe you can go to the basketball game on the weekend, but you can't go to the one that's on Tuesday or Thursday night or whatever. So.
Exactly. And your coworkers are all helping each other. So if you're on the schedule to work a day that your kid has a performance, you switch with somebody. And you can usually switch your hours in 4-hour blocks. Usually that's how our times work, is in 4-hour sections. So like let's say day shift is 7A to 7P. But you have something you really want to go to at 5 o'clock at night, you can just switch with somebody from 3P to 7P and switch your day like that and cover somebody else's 3P to 7P so that you can leave early that day and go to your thing. There's a lot of families that, so you work holidays you get time and a half, so you get paid more to work holidays. There are people who don't have any kids and they just want to work as much as they can and make as much money as they can. So they're willing to take your holidays. They're like, I'll work Christmas for you. I'm trying to earn money. You know, so there's a lot of, you know, out of this, 6-7 years that I was bedside nurse, I didn't have to work a lot of Christmases because a lot of my coworkers were willing to take my Christmases so I could be with my kids.
And kind of like she said too, like if you're working based on your shift, maybe, you know, your traditional Christmas is like a lunch, but maybe you have to move that to like a 7 p.m. dinner. You know what I mean? Like you kind of shift things or kind of make it work if it can happen, or change the day to like the next day kind of deal. But, and don't forget, I know this is a presentation on inpatient nursing, but if you find out that you start as an inpatient nurse and it's not your vibe and you're not, you know, liking what that's looking, you can become an office nurse or somewhere.
Yeah.
Change kind of your location too. So
that's great about why my nurse educator position now is great, because I'm not expected to work holidays. I'm not expected to work weekends. I'm not expected to work night shift. I can if I want to. So night shift nurses need education too. So sometimes I'll come in and I'll teach something in the evening time, but I set that schedule. And I'm not expected to work, you know, holidays and stuff as an educator. So that's all of these, like a lot of those positions, like the positions that have like quality nurse, trauma coordinator, administrator, you're not, those are like Monday through Friday day shift hours.
And kind of also like what she said too, is like in any profession, like those first couple of years are tough years. Like, you know, you're not gonna be able to have your choice of this or that or whatever.
Yeah.
You kind of have to do it, and then eventually, like you said, things start to kind of even out. You get a little more seniority, whether it's nursing or whatever the profession is.
Yeah.
It's just kind of
you kind of have to pay those dues at first and grind it out, and then, you know, now I'm in a position where I can kind of be a little bit more picky and choosy about what I do, because I did those years, I did those hours, I did those shifts. And now I have the experience built up under my belt that I can kind of just dictate what I do next. But the flexibility is great, and usually all of your managers will be more than happy to work with you. You know, I now that I'm in school, like my managers are like, okay, you know, if you need this time off to finish a paper, you know, you could do that. So they're really, really flexible, and they're willing to like do whatever they can to make it work for you. There's a lot of opportunities to make money too in nursing. Like it's easy to pick up extra shifts for overtime. It's easy. They throw bonus money out on the table all the time. You'll get an email saying, hey, we need nurses from 7P to 11P tonight, $30 an hour bonus. So you get the bonus pay on top of your regular pay if you pick up that shift. So it's a lot of opportunities to make money.
holidays, yeah, like
Yeah.
a little extra cash, summer, right?
Yep. Yeah. So.
Any other questions, guys? Jordan, your brain's going over there. Anything else?
What about like family vacations? Like, is it easy to like take off like for like a week at a time, or like however long the vacation will be?
Yep. So I forget what St. Luke's is, the way that they do it. The more every year that you're there, you accrue more and more time. So I've been there for 9 years, and I'm already up to 2 weeks of PTO, personal time off that I can take. But the great part about it is that, like, let's say you work 3 12s. You can work Sunday, Monday, Tuesday of this week, Thursday, Friday, Saturday of that week, have all of those days off, and you don't even have to touch your bank of vacation time. Like, you can tell your manager that's what you want to do, and they'll work with you and they'll make that schedule happen. If you want to use your personal time off and request vacation time, you just have to give them notice, and I've never been turned down vacation time. I don't know anybody that has.
Good question.
Does like working in a hospital like have good health benefits for your family?
Yeah. Yep. So my whole family is covered under the St. Luke's healthcare. I don't know if you're interested in how much it costs, but it's very, very good. And if you stay within the St. Luke's network, most everything is covered, and that includes specialty visits, going to counseling, physical therapy, chiropractors, like all of it's covered. So it's very cheap.